Hello to my audience and welcome to my presentation on influenza outbreak in long-term care facilities. Also included in this will be skilled nursing facility. I worked with a facility which has both long-term care facility and skilled nursing facility combined. So some of my information kind of brushes over both of those topics. But the big point here is about influenza outbreak. My name is Melissa Lodge, and this is for class nursing 451 at Cal State San Marcos. So starting with the issue identification, our problem statement, the problem that's come up is that influenza activity indicators in the United States were higher this year as compared with other years and other seasons at this time of year. This year has been a particularly nasty flu season, and a lot of cases have come up. It's almost triple the amount as usual. The influenza incidence rate in the United States was low this year in October, but has been increasing since November. To put it into perspective, my facility alone, I actually work at this facility also. It's a skilled nursing facility, and we've gone on lockdown twice this year, and I've worked with them for 3 years. We've never had to go on lockdown. We've never been close to a lockdown. This year, we've gone on lockdown twice. I'll go through what an outbreak means and when a facility has to go on lockdown in a little while. Influenza A virus is the most commonly identified influenza virus that predominates the United States. And aside from making people feel just severely under the weather, influenza also causes decreased job performance. It costs money. It's a danger to at-risk patients. And so we do have a quality standard. The National Public Health Goals focus on reducing illness, hospitalization, and death from vaccine-preventable illnesses, with efforts to improve disease surveillance and allow for earlier detection in the emergence and spread of disease. The timing of influenza activity often varies. So each season, we're not sure when the peak of the illness will come through. Most commonly, it occurs in the United States between December and February. And then substantial influenza activity can be observed through May. So how is an outbreak defined? A confirmed outbreak, like what happened with my facility, would be 2 or more laboratory confirmed influenza viruses in the building with residents. A suspected outbreak would be 2 or more ill residents. So that would be residents presenting with influenza-like illness. And when at least 2 patients are ill within 72 hours of each other, and at least one has laboratory confirmed influenza, you may have an outbreak. So there are guidelines here for this. So confirmed, 2 or more laboratory confirmed. Suspected is 2 or more ill residents, or 1 ill resident and 1 confirmed. And then when you have at least 2 patients that are ill like that or confirmed like that, you need to contact the local health department. And that's for every suspected or confirmed outbreak. And you want to do that as early as possible so they can give you guidelines for what they expect from the facility and keep everyone safe so that it doesn't get too out of hand. So our quality variants, I'll explain these graphs in a moment, but Healthy People 2020 gives an annual target of 90% influenza vaccination among healthcare personnel. High vaccination coverage rate helps to ensure that long-term healthcare providers will be protected from influenza, as well as the residents be less likely to acquire influenza from the staff. Currently, the Medicare and Medicaid services require reporting of vaccination coverage for workers. This started in 2013 that they require facilities to report what percentage of their employees are vaccinated so that they can keep track of this and keep track of just the control of illness. So we have the quality standard, and so that's the part of the quality variance. The quality standard is what I just mentioned, the 90% above. At my facility, currently, we have 96 staff members who are at least in close proximity with patients, whether it be the custodial or kitchen, nursing staff, doctors, everyone like that. Out of 96 staff members, we have 17 that are unvaccinated. So we are at 80% vaccination rate currently. So it would be great if we could get up to the 90%. However, we cannot force people to get vaccinated, but there are ways that we can help push them in that direction, and just kind of with education and helping them understand why it's important. And I'll go over that in a little while. The nation's public health goals focus on reducing illness, hospitalization, and death from vaccine-preventable diseases and other infectious diseases. So expanding surveillance is crucial to these ends. We're working to improve disease surveillance, allow for earlier detection, the emergence and spread of disease. Increased surveillance will save lives because it allows maximum time possible for public health response. So that would be like in vaccine production, development of evidence-based recommendations, disease prevention and control. So that's on a large scale. On a smaller scale, when we are surveilling disease in our facility, we are looking for early signs and symptoms so that we can get these patients isolated, cared for, and prevent it from getting too out of hand. So on these graphs, what it shows is on the left side is United States in the flu season last year. And if you look closely on the left, the number of positive specimens, so the peak of last year's flu season was hovering under 6,000. And if you look at this season, which I said is particularly bad this year, the peak of the flu season so far of positive cases of influenza A and B is hovering under 20,000. So that's about 3 times the amount as what it was last year. So very important to keep these things under wraps, like keep education going and just really understand why this is happening, what we can do to prevent it, and what do we do when it happens. So here's our root cause analysis. Long-term care facilities are susceptible to seasonal flu outbreaks, and it can be explosive in long-term care facilities. And I will tell you why. Currently available vaccines are, for one, less effective on older people and those with comorbidities. And also vaccination of long-term care staff, although recommended and encouraged, is not reaching the point that we would like it at the 90%, and that is all across the board. There's evidence that long-term care facilities are kind of running low on their vaccination compliance. And healthcare workers with vaccination can help protect themselves. It maintains the workforce during an outbreak, and it acts as a barrier to transmission of infection to the vulnerable individuals, such as the residents in the facilities. So that's why it's important. Vaccination coverage is decreasing, and efforts are required to improve and protect the vulnerable. So we're trying to get to the 90% compliance. This 90% number is recommended by the CDC, and the reason for it is for something called herd immunity, where if you have that 90% compliance rate with vaccination, you reach what's called herd immunity. And that is where if you have some sort of outbreak or some sort of contact, someone in the facility has the flu, somebody in the community, in the area where you have herd immunity, it is less likely to spread. It is less likely to reach outbreak status. Early recognition is important. However, it can be complicated in residents in long-term care facilities. It's problematic due to nonspecific symptoms and the possibility of atypical presentation and lack of fever in the elderly with influenza. So influenza may present as sudden, unexplained deterioration in physical or mental ability in the elderly and those with comorbidities, and it could look like an exacerbation of an underlying condition with no other known cause. So when we're seeing these cases, we might not know right away that it could be the flu. We won't know to test for the flu. So we need to think about how we can further educate ourselves and those around us as nurses to help with that early detection so we could get the patients isolated, prevent an outbreak. And managers of the long-term care facilities have an important role in this, ensuring staff have ongoing training and infection control, what's expected to maintain compliance, protect the residents. If members of the healthcare team slack on this issue for whatever reason, say you have patients on isolation, you're in a hurry, stressed, maybe you think you're being really careful. I've seen it where individuals will go into isolation rooms. They won't gown. They won't put on a mask if it's droplet. They just think they're just going to be in there for a second. They hurry in, they hurry out. It can cause damage, right? Well, it doesn't take much to carry germs, and as careful as we think that we might be, just doing little things like that can spread germs in an instant. So standard precautions need to be used at all times, regardless of the detection of a suspected outbreak. And then just ensure compliance in the isolation rooms. Make sure you're looking out for each other. And no matter how much of a rush you're in, it's important. The isolation precautions are there for a reason. So we need to be using those at all times. And just a little bit about transmission of influenza. It can occur by 3 routes. There's droplet, which is like a larger size particle. You can't really inhale it into your respiratory system, but what it does do is it's produced by like a sneeze, a cough, a drip, or an exhale. And it travels short distances, but if you are in that short distance, then it can get on you and you can transfer it, or it can get into your mucous membranes. They settle quickly onto the ground or other surfaces, so you are another surface that it can settle on. Aerosol or droplet nuclei, they're smaller particles that remain suspended in the air for a period of time. And those are the ones, that's why we wear the masks, so that it doesn't get inhaled into our respiratory system. And then there's contact precautions. So if it gets on a surface and then somebody touches it, then it can be transferred to another individual. So we have the scope of the problem. What are the consequences of a flu outbreak? So when you have an outbreak, such as at my facility, you need to, first of all, it produces lost work days. When we have an outbreak, workers are getting sick, staff's getting sick, then other staff is overworking to cover those days. Then they might get sick when their immune system gets down. It's just kind of a snowballing effect. Lost work days cost the facility money because there are sick days and they're paid for by the facility when the individual puts in for that sick pay. They aren't at work, but they are getting paid because they're sick and they couldn't come to work because of that reason. The facility lockdown leads to a loss in money as well, because when you are in lockdown, you are not allowed to accept new admissions. And so you're losing money on that, and just supplies for the isolation and just all that kind of stuff. It leads to added work on staff. Like I said, when people are missing work, you have staff covering for them. And then also during an outbreak, there's an added list of things that you're required to do, such as monitoring the patients. You're giving more medication. It's just a little bit higher of an acuity. And it adds stress on the management because they are also monitoring this They've got the lockdown. They're not allowed to accept admissions. Everything's kind of at a halt. They have to change a lot of things around to protect the residents. So that's stress on the management. Lower productivity. Say staff is coming to work and maybe they're not sick. However, their immune system's down, or maybe they have a cold, not the flu, or just whatever's going on. They're stressed from overworking. They're picking up the slack. So just in general, around this time when people are really getting sick, it leads to a lower productivity of the staff. And then there's limited patient access to healthcare providers and services. This season, when my facility was on lockdown, a lot of other facilities in the area were also on lockdown. Like I said, it was a particularly bad season. And so those patients in the hospital who were ready to leave and they needed rehab, they needed a place to go, they were having a more difficult time finding a place to reside and get their care for after their hospital stay. And so things that cause like added work, for instance, in an outbreak, requires you, I'll go over that. How about I go over that in the solution of the problem? So what do we do when we have an outbreak? I'll do a solution for the outbreak as well as just normal condition solutions on preventing the problem, things like that. Let's start with the outbreak. When there's an outbreak, you have to collect respiratory specimens of ill residents with recent onset signs and symptoms. You collect a nasal swab and then those specimens are preferably, you want to do like 5 to 10 residents within 72 hours of onset of symptoms. Really, realistically, anyone who has any signs and symptoms of respiratory illness, a cough, a fever, especially, fever in addition to the cough, fever in addition to a runny nose or sore throat, things like that. We're calling the doctor, we're getting orders for these swabs, and we want to get them back as soon as possible. And then we're also conducting daily surveillance until at least 1 week after the last confirmed influenza case. So daily surveillance, we're charting on any patients who have any symptoms. We're keeping track of their swabs. We're in close contact with the pharmacy, or with the laboratory, to get those results and get medication as soon as possible from the pharmacy to help to treat the flu if they do have it. We're implementing standard and droplet precautions for all residents with suspected or confirmed influenza. So we're doing that for 7 days after illness onset or until 24 hours after the resolution of fever and respiratory symptoms, whichever one's longer. And when we do, when we do have a confirmed outbreak or a confirmed flu, we need to move those patients to an isolation room. And what we did in my facility is we had a hallway designated for that. So anyone who had confirmed or suspected flu was moved to a particular side of the building away from the entrances and put in private rooms on isolation. We also want to consider antiviral treatment, definitely for those with confirmed flu, but anyone with suspected flu, we want to start antiviral treatment as soon as possible. In my facility, in fact, once we had a certain amount of cases, there was a few days where every day we were having about like five or so positive cases come back from the lab. At that point, everyone went on prophylactic treatment. So everyone was on Tamiflu just to stop that because it was spreading obviously so quickly. So prophylaxis for all the residents experienced during that outbreak, regardless of vaccination status, it's recommended by the U.S. Center for Disease Control, the CDC. And so that's what we did. And any considerations for the outbreak? What we did is we had symptomatic residents stay in their rooms. We closed down the dining room. We restricted the activities. Meals were served in rooms. It was just the hallways were pretty dead around that time because we were trying to protect the outbreak and just get it stopped as quickly as possible. Group activities were halted. We weren't doing group activities. We didn't have any new admissions. We weren't transferring rooms unless absolutely necessary. If we needed to move someone to an isolation room or if there was someone suspected and we wanted to move them away from somebody else. We restricted personnel movement from areas in the facility. We closed all the doors between the units. So we have a skilled nursing unit and then we have a long-term care unit. We closed those doors and restricted the movement in between units. And we didn't allow for the patients to go back and forth between the units either. Sometimes it's recommended to limit visitation. We did not limit visitation. However, we did provide at the front office in the lobby when you come in, there was a hand hygiene center, and there were also masks as well as signs stating what was going on, what to be careful for, not to come in if you're sick, please wear a mask even if you're not sick, things like that. And then we were also monitoring the staff absenteeism, counseling about early signs and symptoms of flu, and excluding anyone with flu-like symptoms from coming to work until at least 24 hours after their fever or whatever had resolved. Now, under normal conditions, not outbreak conditions, some solutions to prevent a problem or prevent a problem from getting worse. You want to promote and administer the seasonal flu vaccine. So the flu vaccine is the first line of defense, and annual vaccination is the most important measure to prevent the flu infection. Achieving those high influenza vaccination rates, like recommended, like the 90% recommended by the CDC, it's a critical step in preventing healthcare transmission of influenza to the healthcare personnel and also patients. Strategies that my employment uses to promote that vaccine. What they do is they improve the access. So they offer vaccination during working hours so that you're not coming in on your days off or your time's off. They allow you to come in while you're working. If you have a minute, you just come by the office and you can get a flu vaccination from our infection control. She's our DSW, or DSD, I'm sorry, the Director of Staff Development. She also manages infection control. She's in our office Monday through Friday. And then for other shifts, such as like the knock shift, who's there during times when she's not around, she would come in early at about 6 o'clock in the morning, an hour before knock shift would get off, and allow for them to have access to the vaccination as well. Another way to promote vaccination is requiring personnel to sign a declination form. So this declination form just kind of states that all the information was given. They had proper education, that they were educated about benefits, they were educated about risks, all that stuff, and then that they still declined. So that is their right to sign that form. And then also just, so providing the vaccine at no cost. I know a lot of healthcare facilities really do that, hospitals, things like that. They want their employees to be vaccinated. So that's something that's pretty standard. There's some things that have been recommended that we did not do, such as providing incentives for staff, or in some places they require you to have a vaccination unless there's some medical reason why you can't. My facility did not force anyone to have it. They don't have plans to force anyone to have it, but that is something that facilities have used in the past. So that's on vaccinations, just normal, normal ways to prevent the flu. Sorry about the screen changing. So vaccination, very important on normal prevention of flu and spread of flu. Another one, you want to take steps to minimize potential exposure. So that's respiratory hygiene and etiquette. That's making sure, you know, when we had the outbreak, everyone in the facility was wearing a mask, not just people who were not vaccinated. That's part of respiratory hygiene, just protecting yourself, cough etiquette. Make sure you cover your mouth when you cough or sneeze with your arm, not your hands. Plenty of hand washing, masks, like I said, isolating patients to one area. The minimizing exposure means providing lots of hand hygiene stations, posting virus alerts, things like that. And then you also want to manage the ill healthcare personnel, like you would in an outbreak. You want to do it not an outbreak as well. Make sure the staff knows not to come in if they're sick. An important thing under this is making sure that they don't feel like they have been, make sure that they don't feel like they're in trouble if they call out for being sick. Some people are really worried about calling in and being in trouble with the management. You really don't want that, especially during this season. And if you're at work and you feel like you're getting sick, you want to don a mask right away and report to your supervisor, let them know what's going on. And then not coming to work until 24 hours after your fever is resolved. Always adhere to the standard precautions, hand hygiene, gloves if you're going to be in contact with any sort of body fluids, and then perhaps, like we did, wear a mask at all times, even if you've been vaccinated. You also want to adhere to the precautions, adhere to any droplet precautions, any isolation precautions in the facility. You want to manage visitor access and movement within the facility. Make sure that the visitors aren't moving throughout the units. Make sure when they come in, they have access to a mask, they have access to hand hygiene. All the doors are closed between the units, and put signs on the doors to state that they are supposed to be that way. You're monitoring any activity, any respiratory symptoms that patients may have, and keeping a close eye. Make sure the nurses are letting supervisors know when new conditions come up. You're implementing environmental infection control. This should be done at all times, really, but just making sure to really do like the standard cleaning and disinfection procedures. Make sure you're using lots of wipes to clean all the work areas and prevent any transfer of germs at the nurse's station or at the medication stations, things like that. Also manage the laundry, food service utensils, medical waste. All that should be managed within standard precautions, procedures. Make sure that the staff is trained and educated on like prevention, signs and symptoms, all these things that we've gone over so that they are on the same page. And then also administering antiviral treatment, and also to consider prophylactic treatment for healthcare personnel who's not vaccinated, or prophylactic treatment to patients if they've been exposed to the virus. And so this concludes my presentation on influenza outbreak. I hope that you've learned something. I hope you enjoyed the presentation, and have a great day. Thank you. This is my references if you want to look up any of the information and where I got it.